Happy Thursday, happy Thursday, happy Thursday. It is Therapy Thursday. Welcome to Transforming Trauma with Dr. Triphi. I'm a licensed psychologist in Atlanta, Georgia, but I'm not in Georgia right now, but I practice in the state of Georgia. And I speak the way I do because although I've lived in the US for over 30 years, I continue to maintain the accent of the country of my birth, which is Dominica. Now, Dominica is not to be confused with the Dominican Republic. They're two separate countries. Dominican Republic they speak Spanish, we speak English and the French Creole, and we are further south in the Caribbean. Every Thursday, as best as I can, I show up to teach skills and strategies, to talk about trending topics and make connections between those and psychological ideas. And my hope, my highest intention for transforming trauma is to teach skills to help you, me, think better, feel better, so we can do better. Because a lot of our behavior is driven by our thought life, and the emotions that come out of those thoughts. Yeah. So if we can identify where we're making mistakes, which are actions, things we do, or things we don't do, if we can kind of reverse and kind of pay attention to the emotion that happens right before the action we take or don't take, if we can even go further up and pay attention to the thoughts we're having in our minds that might be triggering the emotions out of which we're acting, then we can cut out a lot of problems. So, tonight I'm talking about a concept called psychological complexes. When I was growing up, I was telling my daughter today, people would say, "You got a complex?" Like if you were acting out, they'd say, "What's wrong with you? You got a complex?" Well, there actually are complexes in psychology. So, you all know me, I like to start with little stories every now and then. I want you to listen to this story. A story is told of a wealthy man. It's a legendary story, it's fictional, of a wealthy man who devotes his life to seducing women. He takes great pride in his ability to seduce women. And these women are of all walks of life, different ages. This man is a trickster, and often he's disguised. So he disguises himself and he assumes other identities in order to seduce women. Thanks to his ability to manipulate his language, as in the way he speaks, and to manipulate the way he looks, he's quite successful in his goal of seducing women. This man believes he's got plenty of time to do things right and to repent for his so called bad behavior. His life is also punctuated with occasional violence and gambling, and in most versions of that story, he kills a man. He kills the father of a girl that he has seduced. This guy actually seduces a married friend of his mother. Now, there are various versions of the outcome of that story. In some versions, the man dies. In some versions, he willingly goes to hell. Yeah. And in some versions, he asks for pardon and he receives divine pardon. Now, who is this man? Do you recognize this person from any story you've heard? If you do, type it in the chat. Type it in the chat. Type it in the chat. Yeah. Okay. So, like I said, tonight I'm talking about psychological complexes. I actually just described one to you. I'm going to talk about it later. So you want to see if your answer was correct. Okay. Now, even if you don't recognize this person from any story you've read, are you familiar with that kind of person? Have you met somebody like that? Here's another question for you. Do you perhaps often feel guilty, or you have the urge to fix things, or perhaps you're overly suspicious of other people, even when there seems to be no obvious evidence for you to feel that way? What I just described were other examples of certain kinds of psychological complexes. So, the idea of psychological complexes were first proposed. When I say proposed, I mean they were brought out, they were suggested by one of the early psychological thinkers. His name was Carl Jung. He was a psychiatrist and a psychoanalyst. That's just a school of thought in psychology, right? And he says that psychological complexes are unconscious. I've talked here about unconscious. Unconscious, being unconscious to something. When you fall and you hit your head and you're unconscious, you are not aware of what's happening in reality. Yeah. So unconscious feelings, we are not aware of them. We're not aware of the source. Yeah. He says these are unconscious feelings and beliefs that are mostly rooted in traumatic experiences. Most of them are, but some may actually be a personality trait. Okay. And your personality traits are stable over time. These complexes are going to impact, they're going to affect, often negatively, sometimes positively, how we perceive ourselves and how we perceive other people. And they do have a lot of impact on relationships. So another early psychiatrist really, was Sigmund Freud. And a lot of you will be familiar with Sigmund Freud. So both of them, because of the school of thought that they trained in and based their practice in, both of them prescribed or proposed the idea of complexes. So I want to do something with you too that Carl Jung used to do with his patients. Now, Carl Jung, remember, is the one that I just mentioned as one of the early psychiatrists, psychological thinkers who came up with the idea of psychological complexes. So, say you came to Carl Jung, what he would do is he would do what's called a word association test with you. And I'll explain what that is. And based on the responses, then he'd come up with some guesses about what psychological complex that person was probably experiencing. So, what a word association test looks like is he'd say a word and he would ask the patient to say the first thing that came to their mind. And what he started noticing was that patients responded to certain words kind of in an automatic, highly emotional way, as if, and it wasn't as if they had prepped for the word that he was offering, but as soon as he said it, they had very strong responses. So he started making the guess that the ways that they were responding were connected to these unconscious beliefs and feelings that they were not even aware of in everyday life. Okay, so again, a psychological complex can be described as a personal, it's individual, all of us, yeah. I rarely use the word all, but yeah, most of us, all of us, it's a normal part of the way our personality is made up. Yeah, it's a normal part of our psyche. Let me say it like that. These are personal, unconscious. They're a little group of emotions, like a little cluster of emotions, memories, perceptions. Your perceptions are what you think about things, yeah, or experiences, and wishes that are organized around a particular common theme. Okay, so I want to start giving you some examples. Like I said, they often are rooted in a traumatic event or traumatic experiences. But if you think about it, They're also connected to who raised us, yeah, where we were raised, how we grew up, what we saw, what we experienced, how we were taught to look at the world, how maybe we saw other people around us acting. Yeah. So, you ready? Like I said, they are distorted. These complexes are often is kind of a distortion of what's really happening. Yeah. But over time, you start seeing it in people and you start observing that it's a pattern. Okay. All right, let's go. I'm going to start with number one. You've probably heard that. Number one is inferiority complex. A person might have a feeling that they're just not good enough, not in a particular task, but just across the board in their life. Now, everybody has off days. Yeah. There are days when you don't feel as if you're doing the best you can, and you're like, man, I should probably work more. I should save more money. Yeah. I should do better. I should study more. These people, though, continually feel like that. Continually feel like that. They see themselves as less capable, less adequate, less worthy, even. Okay? So, compared to other people, this person is always going to be judging. Let me strike always. More often than not, that person with an inferiority complex is going to be looking at themselves and judging themselves as less than the other person. And what some people do is they might try to overachieve to compensate for that nagging anxiety, that nagging feeling in them. Some, however, just don't do much. Some don't do much. Again, this is an individual experience, so people respond to it in a different way. You might notice a person who has a lot of trouble accepting a compliment. Just a little, hey, you look nice today. I like what you're wearing. Yeah. Some people have a lot of difficulty hearing you tell them that they're pretty, that they're smart, that they're cute, that they're whatever it is that you're seeing, because they have an inferiority complex. They think this is just somebody else, but not me. Sometimes they might not care for their own needs, believing that they're not even worth the effort. Like, why should I? Why would I waste my time? It's not going to happen for me anyway. Okay, so that's number one. Number two, flip it up, flip a coin. And you got people with a superiority complex who believe off the bat that they are better than everybody else. They're better than everybody else. They don't have any evidence for other people's level of skill, nothing. They don't care. They are better than everybody else. So they think that they are superior in their peer groups and even with their superiors. And if this person with a superiority complex deigns, when I say deign, I mean come down off of their ivory tower to interact with you or to spend time with you, more often than not, it's for strategic reasons. Like they have their agenda for why they will waste in their minds their time with you. They're doing it for a purpose, they're doing it to get something out of you. That's number two. Number three, we have what's called a brother complex. You can say brother, sister. Yeah. So it can be applied to any sibling with a strong attachment, sometimes even obsession with another sibling. Y'all, and that happens. Yeah. This complex is often rooted in parental problems, yeah, their upbringing, and a certain level of social anxiety. Okay. Next is the mother complex or the father complex. You might call it parental complex. Have you any knowledge of somebody you might have said has daddy issues or mommy issues? So it's a dysfunctional relationship. It's set up by a dysfunctional relationship between the parent and the child. And the person grows up trying to fix broken relationships with that parent, yeah, the broken relationship with whichever parent that they've identified with in that way. They try fixing it though in other relationships. So they end up having so called mommy issues with other people in relationships. They might go to work and act out. I say act out as in whatever rage or whatever feelings they're having towards their mother or they had towards their mother, they might react negatively, say if they had a mommy boss, yeah, a female boss that perhaps generated a certain level of anxiety in them. So the dysregulation that they had with the mommy ends up being transferred to other people in their lives. Okay. A negative father or mother complex might have been formed due to, say, you had a father or a mother who was physically or emotionally absent or inconsistent. There's some parents who they love you if you're doing what they want, but they tell you, many parents will tell their kids, things that make the child think that they don't really love them in a consistent way. If you have a self-absorbed parent who everything is about them or the couple, there's some couples who are so in love, let me say it like that, with each other that sometimes they can create a little circle that leaves the kids outside. So it's a detached relationship with their kids or disengaged or disinterested. Over time, the child can form a mommy or a daddy complex, mother or father complex. Okay. A negative parental complex could manifest itself in self doubt. If I grew up thinking my father was always absent and didn't have time for me and didn't demonstrate his love for me, I might have a lot of self doubt. Yeah. So, can you see how, if I'm doubting myself as a matter of course, meaning at home, at work, with friends, in church, I have that kind of feeling of self doubt. Do you see how that can negatively impact you across the board in your life? It could also manifest itself now in over idealizing other people who we wish were our dad, we wish were our mom, yeah, or who might offer a little bit of something that feels like love. You might have a person with that complex over idealizing somebody else. But at the same time, that person might be really disconnected from their true self because kids need parents to give them an idea of who they are, of who they are, of their value, of their value. So if a child grows up thinking, I'm not valuable because I was distanced from a parent, yeah, you might have never learned how to really feel the sensation of love in your body. Yeah. So you have some people who turn to like real self hatred, self disgust, and even more so disconnecting, yeah, dissociating themselves from their core self, from their core self. Okay. Next one is Casanova. Casanova. People with the Casanova complex are often men. Often doesn't mean always. Yeah. Often men who adore women. Often men who adore women. So the name of that complex comes from an 18th century Italian adventurer and author. His last name was Casanova, Giacomo Casanova. Giacomo Casanova. This person is usually charming, again, often men, usually charming, usually outgoing, gregarious, engaging, attractive. Yeah, knows how to dress, knows how to present themselves well. And Casanova, somebody with a Casanova complex, has a desire to have multiple partners without emotional attachment or involvement. The suggestion, the theory is that can come from a deep seated feeling of insecurity, huh, about how acceptable they are. And so it's a compensatory, yeah, it's a way to compensate for that anxiety of feeling insecure about themselves. They pursue intimate affairs with women to meet that need, to help them feel less insecure, to build their sense of value about themselves. There's some suggestion, that that might be connected, often to boys who did not have a strong masculine father figure leading them in the home. Yeah. So, what do you think? Do you know a Casanova? Now, I'm going to describe another complex that is similar to the Casanova complex, but I'll tell you how it's different. And that complex is the name of the one of the story that I read to start. So before I go there, here's another complex, a guilt complex. Is this one you? Some people seem to blame themselves for everything that goes wrong around them. A person that always blames things that go wrong on themselves, hmm, regardless of, they always find a way to make it to where they ought to feel guilty about whatever it is that happened. These people are very naturally self critical, hard on themselves. They assume the blame, even if it's not due to them. They have trouble being unbiased towards themselves. No, somebody with a superiority complex, they have no issues with being biased towards themselves. And really, it's kind of a preservation, a kind of a survival thing to be biased towards yourself. But these people do the opposite. They have trouble when it comes to judging themselves. They're always wrong. They're overly critical of what they do. They often feel guilty for it. Again, we're human beings, so guilt is a healthy emotion to experience if you did something wrong, illegal, unethical, immoral. But if you did not do any of those things, that's unreasonable guilt. And there are many people walking around with that kind of feeling that they have to take responsibility for everything, even when they had nothing to do with it. Okay, so the reasons for this complex are varied, and a number of experiences can cause them to develop. Now, the thing with a complex is like, hey, it's hard to tell where and when exactly a complex develops. As kids, again, as kids are doing the best they can, and we can pick up those ideas about ourselves and about other people in childhood. That's where that stuff gets cooked. Rarely would you develop a complex, rarely, not to say it doesn't happen, as an adult, because as an adult, you've already figured out yourself. Yeah. Complex number 7 is called a martyr complex. Now, what is that? Um, in Dominica, where I'm from originally, we have a word called Mauti, and Mauti is the Creole for martyr. Souffre Mauti is if you're suffering the kind of pain of a martyr. A martyr is somebody who dies for the sake of other people. Yeah, you have, if you're a Christian, you might have read about certain disciples of Jesus who were stoned to death. So these people are called martyrs. So this is where you have people putting everybody else first to their detriment. Everybody else first. They're seeking sympathy and validation and a sense of specialness and as a way to receive attention by suffering. So keep the visual in your mind of somebody being stoned to death. Yeah, I'll take it on everybody else's behalf. I'll save you on behalf of everybody else. That person, for attention, for in psychology we call it secondary gain. There's always, we think that they're being stoned to death, but they're actually getting something from it, as in attention, as in love, as in respect. However, with people like that, if they don't get anything for it, as in if they don't get the attention they were looking for, or the good name they were looking for, yeah, or the sense of specialness they were looking for because they made this big sacrifice, or they keep making sacrifices for everybody, but nobody's making sacrifices for them. So they start getting nasty. They might go to self harming. Mm. And oh, then I guess nobody loves me, nobody cares about me. I'm always the one caring for everybody else. It can also turn into passive aggressive behavior. Yeah, passive where if I'm a person who my personality is about I'm the one doing for everybody else and they don't even love me but I'm doing for them. If I'm feeling so overwhelmed because I'm the nice person who's always doing for other people, I might not directly come out and express my feelings to you. But I might stop talking to you. Might stop talking to you. Yeah, they don't care about me. Look what everything I did for them. And yeah, I sacrificed my needs. I put their wants ahead of mine. That is what a child does. A child doesn't understand yet how to care for itself, how to set boundaries and say yes or no, how to say, ouch, this is too much. So, again, there are some people who, in their raising, in their early development, they might have grown up with parents who did the same thing. There's some parents there are some parents who think, yeah, they have to take care of everybody else. And you as a child, you see this and you think that's the way to be. Some of this is fundamental to many religions, and women often seem to uh, take on that role more often than men do. Yeah, it's common, like I said, in people who grew up with parents who victimize themselves. It's common where the roles were reversed in childhood and the child needed to be the one comforting the parent. These kids are called parentified children, where early on you have to become the one who takes care of. It might be a sick sibling or younger siblings. And you might have grown up not even having your own feelings acknowledged. You might not even know. When I say not even know, there are some people who don't know how to say, ow, this is hurting. There are some people who don't know how to use these words to say, uh, you might not be meaning to hurt me, but ouch, this hurts. I don't like that. I want this instead. There are many people who will not tell you, thank you for this, but this is not what I asked you for in the store. And they'll just take whatever it is they get. Yeah, that's a martyr kind of syndrome. It's a complex, okay? So you want to look out for that, because if you're the one in that position, can you imagine the rage that is unspoken in people who walk around with that idea about how they need to be? Some people will actually hurt themselves in secret. There's no need for that. There's actually no need for that. Yeah. Except if you're in a survival situation where you have to, you might be the eldest and you're like, okay, yeah, you all can beat me up, but my little siblings can escape. But this cannot be a perpetual way to be in the world. It's going to hurt. It's going to hurt. It's going to hurt. The next complex is a persecution complex. This one is an irrational fear that you're being treated poorly. This one is irrational. Yeah, it's delusional. It's a delusion where the person always thinks that they're in danger. Somebody's after them. Somebody's out to get them. People don't like them. Yeah, I'm the only one they don't like. They're always looking for me. They're always looking to start stuff with me. They think that nobody's there to support them, and they actually start demonstrating paranoid behaviors. Now, too much of that, and that's a diagnosable condition. They find it extremely difficult to trust people. Yeah. And they might be, like I said, overly suspicious of people to the point that it borders on paranoia. If you think everybody's out to get you, what are you going to do? You're going to stay on high alert. So you're going to be very hyper vigilant, always looking. Yeah. Always looking. It's going to be difficult for that person to really connect to other people because they don't know if that other person is out to get them. So sometimes that kind of delusional behavior, thought pattern, complex, can stem from trauma. Like you might have really, quote unquote, earned it, right? Where something horrendous happened, or you grew up in a kind of place where it was just repetitive, that people were untrustworthy and doing bad things. Yeah, that might be from trauma, or sometimes from brain issues, from mental health issues. So I talked about the story of the wealthy dude, yeah, who devotes his life to seducing women, who takes great pride in his ability to seduce women of all walks of life. Because he's a trickster and because he often disguises himself on purpose, disguises in language, actually lies. Disguises in language means I know what I want. Huh? I know what I want, but you don't know what I want. Earlier on, I talked about the Casanova complex, where you have men who are just, they're out for fun. Um, if you're from Dominica, Asa Banton has a song, If You Give It to Me, I'll Take It. That kind of idea. But it's about fun, and both people know what's up. The Don Juan complex is typically a man that views women as a source of pleasure. In today's world, you might look at it as sexual addiction. Now, a lot of people don't believe that they're working with a sexual addiction, but that's what that is in many instances. So, this is a womanizer that charms the ladies, seduces the ladies. And I say seduces because in the Don Juan complex, the man is not telling the woman, yo, I don't want a relationship. Yeah, we're just having fun. Casanova does this. Don Juan is going to be telling this woman that, yeah, I want to be with you. Yeah, I see us married. Yeah, future faking. Okay, future faking. Yeah, yeah, I want to be with you. This kind of man is going to leave the woman who believes him in pain and at the hospital because he will not settle down. His aim is not to settle down, his aim is not to create a relationship, but he will say that that's what he wants. This man doesn't feel anything emotionally towards the people that he conquers. In his mind, it's a conquest. Yeah, it's a notch on the belt. Yeah, he doesn't feel anything about it. But what's kind of dark about that complex is that he says he does. So he knows he plays the game very well, but his aim is not about emotional connection and building any life. Yeah. Some people will say the main difference between the Don Juan and the Casanova is that Don Juan is out here hunting for women in particular that he thinks are a challenge. The nun, the virgin, other women, married women, women he thinks are belonging to other men. So it'll feel like, yeah, I did something. Yeah, I pulled her away from her husband or her fiance or her boyfriend or whatever. Yeah. Oh, she didn't want to be with anybody, but she went with me. That's a Don Juan complex. So this person is really lying about uh, life and love, lying about life and love, and a lot of people get hurt, including that person, because what a person like that misses is the opportunity to really connect emotionally to a woman. Okay, so there are several other complexes. I'm going to end. Some others are like the God complex, where people think, hey, it's kind of narcissistic. Like, I'm it. I'm it. They lack empathy. They think that they're answerable to nobody. That's a God complex. There's also one that's called Oedipus complex and Electra complex. We're not talking about those tonight. I'm going to end on what's called the hero complex, which is, hey, I'm it. I'm the hero of the story here. This person wants to be the center of attention, and they'll usually create situations where they have to rescue someone. So it's called the hero or the savior complex. They're always looking for somebody to rescue, and then to tell everybody they rescued that person. Yeah, I did such and such for so and so. Yeah, some people actually believe it's their mission, and like their job is to make other people better. My job is to fix them. My job is to heal them. My job is to make you better. Yeah. The added piece is they want the glory of it. Yeah. They want the glory of it. Some people will actually start a crisis. Imagine a firefighter setting a fire to say, yeah, fire, 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 to be the one to put out the fire. Some people will actually start a crisis so they can come and rescue you. Hmm? They might say nasty. That happens in like uh, DV, domestic violence, intimate partner violence, relationships, or if you have a narcissistic kind of person who will hurt you, they know they're doing something to hurt you, and then they'll come. I'm so sorry. I'm so sorry. You're the, yeah. Okay, stop crying. It's gonna be okay. But they're the one who hurt you, and they knew they would. They knew they were hurting you. Yeah, so they cut you to heal you. Okay. Did you hear yourself? Did you hear somebody that you know? Yeah. And have you ever met a Don Juan? Well, is there a way to fix this? Are there ways to heal this? Yeah. Are there ways to heal this? Well, the thing about complexes is that we're human beings. And so you probably heard yourself in there because complexes are kind, like I say, they're kind of normal responses that we human beings have to our experiences. So if I find myself to be the savior, I can fix him, I can fix her, I can fix everybody. People, especially in the healing professions, like, oh, yeah, we think, yeah, we should be able to quote unquote fix everybody. No, 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 no. You're going to have to, if you recognize any of these complexes that I described, I'm going to encourage you. But you don't have to do anything but die, really. I'm going to encourage you to start from a place of acceptance. Radically accept that, as an adult, this is who I see myself to be. Okay, okay, okay. All right. I just saw that in me. I didn't realize that dark. I didn't realize that dark. Yeah. But this is what I see. I guess maybe I've even heard other people tell me that this is how I am. Well, accept it. This is how you are sometimes. Hmm? Accept it, because sometimes we can come hard at our problems. We can come so hard at our problems that we actually give it more energy. Like it feels bigger because whatever we focus on gets bigger. Yeah. So you kind of want to neutralize that tendency we have by kind of coming at it at a calm, accepting place. Okay, I see that tendency in me without judgment, as in, I don't have to start calling myself names. Yeah, I don't have to start calling myself, I'm a fool for being a martyr. Why do I always do for everybody else? Because that's not going to help. So it's about clear, calm, cool, accepting. All right. Okay. Now remember, many of these complexes are unconscious to us. So we end up doing these rescuing of other people before we even know it. So what you going to do? Start to practice paying attention on purpose. So you can raise your awareness, you can learn yourself more. So you start seeing what your triggers are, like what feeling maybe pushes the behavior. Like, is it when I feel anxious? Is it when I feel afraid? Is it when I feel helpless that I jump into that behavior that ends up not being in my best interest? Yeah. Stay curious instead of judgmental. Investigate. Let's investigate. Learn yourself. Become a professional. Yeah, become a boss at understanding yourself. And that takes time. That takes quiet time in particular. That takes attention and focus in a way, like I said, that it's not in a state of high anxiety. So you can do that well with a professional. You can do that well with a therapist. You can do that well when you're practicing meditation. You can do that well when you're quiet and you're praying. Okay. In therapy, there's something we call parts therapy. So if you think about it, when we're kids, we're doing the best we can. So again, you see this behavior in your family, you learn it, or you had a dad who wasn't there and this is how you managed it. Remember what I like to say about the adult having to return and rescue the child. So, what you're going to be doing is the adult part, who's wise, clear minded, who can see that, has conversations with the child part, because you're going to have to almost reparent that child part. Give thanks to the child part because the child was doing the best it could by switching up and becoming a Don Juan to manage their anxiety. Hmm? So appreciate what the child did to help you survive to even become an adult. That's very important when you're dealing with uh, parts of yourself you want to adjust. Yeah, because those parts showed up to support you at a certain point in your life. So now, essentially, you don't want to just kick it to the curb without saying thank you. Yeah, without saying thank you. I think hypnotherapy is a powerful, powerful, powerful tool to do this kind of work because by nature, hypnotherapy brings you to a mental state where you can access a lot of hidden information. When I say hidden, hidden from your normal conscious waking state. So, these are my suggestions as far as what to do with these complexes. Okay? And nobody is immune. We are human beings. We were children. We did the best we could. Yeah. But because we couldn't move through life with all of this information, they just kind of stay in the unconscious file. And we have to do work like get quiet, work like pray, work like go to a therapist, a professional to dig into those reserves, to bring it to bear here today as the 40 something year old, the 30 something year old, the 50 something year old to create the life we want. So This is my offering for you tonight. Bonsoir, Indigenous Bushman. How are you? Good night. Elizabeth, good night. Anthony, my brother, Sakafet. Yes, y'all. So there are many complexes. And again, we're human beings, so it happens. Yeah. In a state of calm and intention, investigate yourself and see, hey, have I heard that from other people? Because often you will have heard it from other people that you are a particular way. You're bossy. You think you're the boss of you. Like you might have a sister who's always trying to tell you what to do. Yeah, always trying to tell you what to do. As a 60-year-old. And she just got herself a little sister complex, which is like a parental complex. She's like, for those of us with the parental complexes, I mean, some of us, there's some dads who are not there for their kids, and there are some who are too there. Same for mommies. Some of us are not there, and some of us are just oppressive. And so kids have these responses as a way to survive. Yeah. So the child might develop a mommy complex. Yeah. Mommy issues or daddy issues. All right, y'all. Happy Thursday. Thank you all for listening. I appreciate you. I will see you all around the way. Remember to do your best to think better. Learn how to think better. Thinking better is practice. Thinking better. I was talking to a gentleman today, and we were talking about the fact that he was feeling better because he has a history of depression. And the session prior to this one, he was feeling very bad. And so he said he actually used the coping skills by capturing negative thoughts that were kind of driving him down into the abyss of depression. So when the thoughts came up, negative thoughts that made him feel, so thoughts feel, made him feel sad, and he might end up using. Let me tell you all, I'll do a session on addiction soon. Yeah. So instead of that pattern of the behavior of using drugs, you reverse, pay attention to his sadness, and go to his thoughts and capture the thoughts that were triggering the sadness, that were triggering the drug use. So this is how we change. This is this one path to change. Okay. So hope you'll have a good rest of your week and enjoy the weekend. I'll see you all next week. Peace.